If your shoulder has been hurting for weeks and nothing you have tried is making it better, there is a good chance you are treating the wrong thing. Shoulder pain is not one condition, it is several. And the exercises that help one type can actually irritate another. Most people just search for shoulder stretches and start doing whatever comes up first. But without knowing which structure is actually causing the problem, you are essentially guessing. And a wrong guess with a painful shoulder can set you back weeks. I am Dr. Robert Anderson. Today, I am going to walk you through 3 simple tests you can do right now sitting or standing. Each one points to a specific structure inside the shoulder. Once you know which test matches your pain, I will show you the exact exercises for that type. Safe, specific, in the right order. And there is one exercise near the end of this video that most people with shoulder pain never do. It does not look impressive at all, but it is often the single most important movement for long-term recovery. I will tell you which one it is when we get there. Let us start with the tests. Test 1. The side lift pinch. Let your arm hang completely relaxed at your side. Now slowly lift it straight out to the side. Palm facing down. Move slowly. There is no rush. For the first part of the movement it should feel fine. But somewhere in the middle range you may feel a pinch. A sharp catch. Maybe a dull ache that makes you want to stop. Here is the part that surprises people. If you keep lifting past that painful zone, the pain often disappears again. Pain then no pain. That specific pattern is called the painful arc, and it tells us something very precise. There is a small gap between your arm bone and the bone on top of your shoulder. When your arm passes through that middle range, the soft tissue structures inside that gap get compressed. That is the pinch. You have probably felt it reaching into a cabinet, putting on a jacket, fastening a seatbelt. If that sounds familiar, remember this test. The exercises for it are coming. Test 2. The empty can. Hold your arm straight out in front of you, angled slightly to the side, about halfway between forward and sideways. Now turn your thumb downward, like you are pouring water out of a can. From that position, try to hold the arm up while pressing down on your wrist with your other hand. Just light pressure. If that causes pain at the top or front of the shoulder, or if the arm feels surprisingly weak, that is a positive result. This test points to one specific muscle in the rotator cuff, called the supraspinatus. It is the muscle that initiates every time you raise your arm. When it is weak or irritated, reaching a high shelf, washing your hair and pulling a shirt over your head, all become harder than they should be. Most people think their whole shoulder is failing. It is usually this one muscle. Test 3. The outward turn test. Bend your elbow to 90 degrees and keep it tucked against your side. Now press the back of your wrist outward against a wall or door frame, as if trying to rotate your forearm away from your body while the wall resists it. If that causes pain at the back or outside of the shoulder, or if it feels noticeably weaker than the other side, that is your answer. This pattern shows up in people who feel pain while steering, pulling a door open, or reaching across the body. Now here is what I need you to take in before we move to exercises. If more than one test caused pain, that is actually common. Do not worry about getting a perfect label. Just ask yourself which test felt most like the pain you deal with in real life. That is where you start. Exercises for Test 1. The side lift pinch. Exercise 1, pendulum swing. Find a sturdy table or the back of a chair about waist height. Place the hand of your good arm on it and lean forward slightly. Let the sore arm hang straight down. Completely relaxed. No tension. Let it feel heavy. Now make small gentle swings. Forward and back for 30 seconds. Then side to side for 30 seconds. Then small circles in each direction for 30 seconds each. The whole thing takes about 2 minutes. Here is why it works. When the arm hangs freely, its weight gently pulls the arm bone downward and away from the bone above it. That opens the exact space where the pinching happens. And because you are not lifting against gravity at all, the irritated structures get a break. Keep the swings small. If you go too big or too fast, the shoulder muscles engage to control the movement and the benefit disappears. Exercise 2. Table slide. Sit at a table with a small towel under your forearm. Palm down. Elbow close to your body. Slowly slide the towel forward along the table surface. Let the arm glide out in front of you until you feel a gentle stretch in the shoulder. Not pain. The moment it becomes uncomfortable, stop there. Hold a second. Slide back slowly. 8 to 10 repetitions. The table supports the full weight of your arm the entire time. The irritated structures inside the shoulder do not have to work at all. You are rebuilding range of motion without loading the joint. Do not push past the first sign of real discomfort. You are asking the shoulder for permission, not forcing the door open. Exercise 3. Shoulder blade squeeze. This is the one I mentioned at the beginning. It does not look like much, but it may be the most important movement in this entire video. Sit tall in a chair, arms hanging relaxed at your sides. Now gently pull your shoulder blades toward each other and slightly downward. Imagine tucking them into your back pockets. Do not shrug up. Do not arch your lower back. Small and controlled. Hold 5 seconds. Release slowly. 8 to 10 repetitions. Here is why this matters so much. The way your shoulder blade moves directly controls how much space exists inside the joint. When the shoulder blade sits poorly, that pinch zone stays tight no matter how much you stretch the arm itself. When the blade moves well, the bone on top lifts slightly and the space opens. Most patients who do this exercise consistently notice the side lift pinch test improving within 1 to 2 weeks. Exercises for test 2. The empty can. Exercise 1. Wall slide. Stand facing a wall 1 step away. Place both forearms flat against the wall at shoulder height. Slowly slide both arms upward, keeping the forearms in contact with the wall the entire time. Go only as high as comfortable. Then slide back down. 8 to 10 repetitions. Breathe out on the way up. Do not let the forearms peel off the wall. Do not arch your lower back as the arms rise. Exercise 2. Isometric press into the wall. Stand sideways with the sore shoulder facing the wall. Elbow bent to 90 degrees. Press the outside of your elbow gently into the wall as if trying to lift the arm outward. The wall does not let it move. Start at 30% of your maximum effort. Hold 8 to 10 seconds. 5 repetitions. After 3 to 5 days with no increase in pain, move to 50%. After another week, 60%. Never jump to full effort. The supraspinatus responds to patience far better than intensity. If your shoulder keeps flaring up during strengthening, this is almost always why. Too much too soon. Exercises for test 3. The outward turn. Exercise 1. Assisted rotation with a stick. Hold a cane or broom handle with both hands in front of you. Elbows bent to 90 degrees and tucked at your sides. Use the good arm to gently push the stick so the sore arm rotates outward. The elbow on the sore side stays pinned against your body. Only the forearm moves. 8 to 10 repetitions. Do not twist your trunk to create extra range. Keep the movement small and focused at the shoulder. Exercise 2. Isometric outward rotation into a wall. Same setup as before, but now pressing the back of your wrist outward into the wall. Elbow tucked. 90 degrees. Press at 30% effort. Hold 8 to 10 seconds. 5 repetitions. Same progression. 30% for several days. Then 50. Then 60. Never into sharp pain. One important thing before you go. These exercises work well for common mechanical shoulder pain. But please see a doctor if your pain started after a fall and has not improved. If the shoulder feels unstable. If pain is waking you up at night regularly. If weakness is getting worse over time. Or if you have been doing the right exercises for 4 weeks with no change at all. These signs can point to a tear or something that needs imaging. Here is your plan for the next 7 days. Start only with the exercises that match your test. Do not add the other sections yet. After 1 week, test your shoulder again. If that movement feels even slightly easier, that is real progress. If nothing changes, slow down the movements and make sure you are not pushing into sharp pain. Shoulder pain rarely fixes itself. But with the right exercises in the right order, it responds faster than most people expect. In the next video, I am going to cover what happens when shoulder pain is also disrupting your sleep and the specific positions and adjustments that protect the joint through the night while everything else heals. Subscribe so you do not miss it.